Thank you guys all so much for being here. In tonight's talk, we're focusing on how nutrition and lifestyle choices can play a powerful role in supporting mental health in children and teens. This talk is about simple, effective strategies you can start using right away to support mood, attention, resilience, and overall well-being without needing a chemistry degree or a full pantry makeover. Our speaker tonight is Dr. Jennifer Brix. Dr. Jen is a licensed naturopathic doctor, a health educator, a public speaker who's passionate about empowering families with clear, evidence-informed tools. She has particular expertise in digestive health, hormone balance, and brain-related health conditions. So you guys are in very capable hands, and we can get into it. So if you can please help me in welcoming Dr. Jennifer Brix. Thank you for being here.
Thanks, everyone. I'm just going to use this so it's a little bit easier for me, so I don't have to yell at you. I'm a little bit soft-spoken when it comes to these, so this is a little bit helpful. Okay, thank you so much for coming. I know it's a bit of an intimate talk tonight. I think it's really important that I should ask, is this really echoey? Is it still? It's like on party mode and I can't get it off. Okay, is that better? Maybe a little bit better? Okay. It is a karaoke machine, so we'll be doing that later. No, just joking. Okay, so mental health in children and teens. Deeply personal topic for a lot of us. I don't know if you are parents or caregivers, teachers, health practitioners, but I think as a whole, we all need to come together to help understand this topic and also fight for our kids' health. These conversations, can stir up a lot of things, can stir up worry, a lot of worry, guilt, frustration, but I think that the purpose of tonight's talk is really not to add more fear or anything like that, but really to create a space for understanding so that we can create that resilience and a meaningful action for our children. So I've already had a really lovely introduction, so thank you, and thank you to Health Essentials for having me. What we're going to get into tonight, I'm going to start with sort of the statistics, so a little bit of a depressing component there because it is the reality of our health crisis in Canada. Then I'm going to focus on some of the brain busters. We call them brain busters. A lot of this I actually got from Dr. Karen Jensen's book. So Dr. Karen Jensen is a colleague of mine. We worked together many years ago. She's a retired naturopathic doctor, and there's a lot of great information in that book. So I'm trying to summarize that to a certain extent, as well as provide some of the clinical pearls I've used in my practice. So she coins them brain busters. She and I have had this conversation, but basically things that really impact mental health from a physiological, physical, biochemical standpoint. Then I'm going to touch on the gut connection because this is very important. We know probably all of you have heard of the gut-brain axis. There's that literal physical connection between our gut and our brain, and that can play a really big role in mental health. And it is something that, as parents or caregivers, at least you have the opportunity to control to a certain extent. Then we'll focus on the positive and the brain builders, so things that actually support our brain function, again, from lifestyle perspective, all the way up to some supplements that you can safely give your children. And then finally, just a summary on that support tactics. We are, I don't know if there was a handout that came up, but we do have something that we can share with all of you. I can also share a PDF of tonight's presentation if you want to take it home and have that information to read later, when you're bored and nerd out a little bit. Okay. Now, I don't expect anyone to voluntarily, raise their hand, but I'm just curious if you have a child that has a mental health concern or you're a caregiver. Again, if you want to stay anonymous, that's fine. I'm just curious if you're here for that. I mean, I have a 4-year-old, so I could say she's not quite at that stage where she's not in school yet. She's going to be in school next year. So we are trying to be very vigilant about that mental health. But I have a lot of friends who do face those difficulties with older children for sure being diagnosed. So you're not alone if that's why you're here. 1 in 5 children does live with a mental health disorder in North America. And we are seeing a lot of ADHD. Of course, the diagnosing has gone up, so that's part of the reason. But it's 1 in 9 right now, and it probably is 1 in 8. Actually, this is about a year old in terms of statistics. 1 in 9 children under 17 diagnosed with ADHD. Depression and anxiety are among the leading causes of illness and disability among adolescents. We see substance use disorders doubling and eating disorders increasing, and suicide is the second leading cause of death for youth aged 10 to 24 after accidents. The number of young people, this is quite interesting too, because the pandemic played an interesting role. After that happened, antidepressant medication prescription went up by 64%. Massive amount, right? So there are uses for pharmaceutical medications. I'm not against that necessarily. I do prescribe medications. I typically don't do that with children, especially not as a first-line therapy, but it can be important for some individuals. But it has been shown, the Cochrane review did find that antidepressants do lead to improvements, but they're very small in children aged 6 to 18, and there is evidence of 58% increased risk of suicide-related outcomes for those on antidepressants compared with those given a placebo. So again, if that is the route that you are faced with, just be very mindful that these risks exist, and there is that risk-benefit ratio to consider. Okay, so why is this happening? Why are we seeing this, blowing up in children, and what's going on in our children's brains? Well, we know that they're still developing until our mid to late 20s. Used to be like, oh, once you're in, you're 18, 19, and you can drive and vote and drink alcohol and all those things, your brain should be fully developed, and that's not the case. Our child's brain also derives much more pleasure than an adult's brain when it comes to rewarding behaviors like social rewards or junk food or sugary food. So they're going to be more likely to exhibit behaviors like addiction when it comes to things like that, because their brain just can't deal with that type of thing. They don't have that same fixed sense of self that we do as adults. In addition, of course, hormones, right? Hormone changes occur, raging hormones in our youth, in our teens, that can affect mental health and decision making. And again, being understanding that that brain is still not developed for quite some time. And a lot of risk factors. And these are the things, like some of these we're going to discuss tonight in terms of how to limit that risk, because we can control it, and some things it's more difficult. And some of these things have to do, with conversations with teachers and schools and things like that, or wherever your child may be spending a lot of their time. So relationships with peers, we see that like poor relationships with peers, confusion in terms of sexual identity, access to social media. I actually have a slide on that next, because this is a big deal, a big issue. We're seeing hopefully some movement though with banning that in younger children. Cyberbullying, sadly very common, can lead to all sorts of different feelings and emotions: anxiety, humiliation, anger, issues with self-esteem, isolation, and we have also seen, of course, suicide in kids when it comes to cyberbullying. And I'm not trying to date myself or age myself here, but it wasn't a thing when we were growing up, right? You could physically remove yourself from that, although it was still difficult. With bullying, you could physically remove yourself from that situation. Now with smartphones and social media, you can't get away from it. It's with you day in, day out. Climate change worries, quality of home life, and then some of the things we will talk about a little bit more in depth tonight. So nutrition and how to limit ultra-processed foods. Reactions to food, so allergies and sensitivities, right, that can really impact how a child's brain functions. Toxins in our food and in our environment. Chronic stress, hormone changes, skin disorders, that's really interesting, but of course that makes a lot of sense with self-esteem, and skin disorders really do impact mental health quite dramatically. And then finally things like genetics. Okay, so just with social media, this is from the US, but the US Surgeon General recently issued a new advisory on social media stating that it is the defining public health crisis of our time. So just let that sink in. It's suggested that they should and will soon come with a warning similar to that on tobacco and alcohol. We know, again, in Australia recently passed a bill and has now begun to ban social media for children under the age of 16. And I know Canada is in conversation with doing the same. Also interesting though, we have to look at ourselves as parents, if you're a parent here. A recent study in Canada found that when parents are perceived as distracted on their phones or other technology during social or family interactions, it can affect the mental health of their children. So also that distraction, but being on that device while your child is, having a conversation with you can be very detrimental to their mental health. So, we have to curb it as well. All right, so now on to some of the things that we can hopefully monitor and play a role in impacting with our children from a standpoint of hurting our brain. How do we prevent this? And the first is ultra-processed foods. Now, I think we're getting a lot more, you may be eating a lot more than you think. I was certainly surprised when I saw the statistics out there. We know that ultra-processed foods are not great. They don't really provide much at all, besides calories. And a recent study, actually out of, I think it was 2025, looked at 10 million people, massive study, 10 million people. They found that the consumption of ultra-processed foods can lead to over 30 different health conditions. So heart disease, anxiety, cancer, early death, there were so many in that list. Pretty much the most common ones that you're familiar with, right? Ultra-processed foods really have no place in our diet. But unfortunately, and I think it's a little bit higher, it's definitely higher in the US, but Canadians are getting a minimum of 48% of their calories from ultra-processed foods. It's like half of your meals on average. Now, you are customers of Health Essentials, so I am always assuming that probably you're more informed, well-informed about nutrition and making good choices. But for the average Canadian, it is about half of their caloric intake. So everything from cereals and breads and snacks and frozen meals and fast food, all that stuff. We're all guilty, I'm assuming, right? Guilty of sometimes going for those quick things. Even a healthy fast food would be considered a healthy. Processed food is not necessarily healthy yet.
Most people get their antioxidants from coffee.
Good call. Yeah, most of us are getting our antioxidants from coffee. Yeah, I like that. I might use that in another presentation. All right, so what do we know how it relates to mood in children? Well, we know that there's a direct relationship with the intake of ultra-processed food and mood changes, anxiety, attention, and learning problems in children. They contain no nutritional value, right? No antioxidants, no vitamins, no minerals, really no good fats. They're pretty much full of things like more saturated fats, trans fats, processed proteins and sugars, and addictive additives like flavors and coloring. And the addiction scale shows that roughly 14% of adults and 15% of adolescents do show those clinical signs of addiction to ultra-processed foods, which is the similar rate to alcohol and tobacco. So we are addicted. The US stat for ultra-processed foods is 67%. So 67% of the caloric intake in children aged 2 to 19 is coming from ultra-processed foods. Okay, now we can't go anywhere without mentioning sugar. Sugar is its own entity. It isn't really considered an ultra-processed food because it's an ingredient in ultra-processed foods, but it really is lumped in. But we have to kind of hone in on it because I think there are some numbers to be mindful of. Blood sugar, simple sugars can raise blood sugar. That creates a lot of oxidation in our bloodstream and can impact things like our insulin levels, stimulate the production of free fatty acids in the liver, all those things promoting inflammation. We've linked high sugar intake to depression, anxiety, learning problems, irritability, and emotional outbursts. And this is where the number comes in. So this is what it's funny because my husband has a sweet tooth, and unfortunately my daughter has inherited that. I don't. This actually doesn't work on here. Okay. But the number to be mindful of that I tell my patients is to try to get 10% of your daily calories or fewer from sugar. If you can, 5%. What that works out to roughly is about 25 grams of sugar a day, 5 teaspoons. So 25 grams, what does that look like? So really anything that has a nutritional label, whether it's healthy or not, is going to count towards that sugar. So it could be Coca-Cola, sorry, it could be soda. I won't throw anyone under the bus. It could be a soda pop, or it could be a kombucha. They often will have similar amounts of sugar, unfortunately. Kombucha is usually a little bit less, but often even a healthy drink, I know they're here and I know I drink them. My husband really enjoys them, but they will still contain 20 or more grams of sugar in a bottle of something that would be considered, a health food. It's still sugar that will stimulate all of those processes in your body, right? So that's one thing I recommend. Go home, if you're curious, just have a look. I had one patient the other day telling me, I eat very healthy, very clean. I do have a bit of a sweet tooth, so I said, can you go and tell me how many grams you're getting in, say, take 3 days and then divide that by 3 and tell me. He was about 100 grams per day on average. And he felt that he was eating a very healthy, sometimes he would dive into a bit of dark chocolate. But it's the condiments, it's the sauces, it's the things that you purchase that are pre-made and processed that will contribute. Doesn't count when you are looking at whole foods, whole fruits, whole vegetables, whole grains. That doesn't count. There's no label on those things. It's as soon as it's been processed in some way. So if you take an apple, that's great. But if you juice that apple, you now have sugary water with some vitamins and minerals. You've taken out the fiber, taken out any protein. So that sugar will count towards your 25 grams. And, if 25 grams is too much to really get down to, then just at least aim for, 50 and then see if you can improve that in yourself and your children. Speaking of juice, the American Academy of Pediatrics has declared that fruit juice has no role in a healthy diet. So it really should not be considered something to, act as a drink or act as a hydrator in our children. When blood sugar rises because of that sugar intake, of course, what goes up must come down, and we typically will have a bit more of a crash, especially with those simple sugars. That crash can cause symptoms like fatigue, mood swings, crying spells, irritability, anxiety, and angry outbursts. So if you want to prevent that, you know what to do. Okay, stress connection. Because we'll talk a little bit about how to manage stress in the coming slides. We know that higher levels of stress are exhibited in teens compared to adults, and also higher levels of anxiety and depression. Prolonged stress can create a cycle of emotional dysregulation, especially in young folks, because of the way cortisol acts in the brain, which is our stress hormone. And we did see that, again, during the pandemic, that stress caused adolescent brains to age more rapidly than normal. So it actually caused the amygdala, which is involved in emotional regulation, sort of the reptilian brain, as well as the hippocampus, which is involved in memory storage. Those shrunk in that demographic after the pandemic with the stress. When it comes to sleep, this is also a bit of a concern. Roughly 58% of middle school students and 73% almost of high school students are getting less than the recommended hours of sleep, which is 8 to 10 per night in those demographics. And we know with sleep, there is a stress connection. When you restrict just one night, you have just one bad night of sleep restricted to 4 hours, your cortisol, your stress hormone, will go up by about 37% the next day. So just that little bit of lack of sleep, you're going to feel horrible, but you're going to be more susceptible to stress because your cortisol is much higher in your bloodstream. That obviously impacts mental clarity and capacity and generally your response to stress that next day. Okay, so just to touch on the gut and the gut-brain connection, we know that those brain busters that I've just mentioned, so ultra-processed foods, stress, lack of sleep, can impact our gut health. Also things like chemicals like phthalates, overuse of antibiotics can impact our permeability. So our gut should really be a solid tube, right? And anything that's going to go into our bloodstream really should be going through the intestinal cell first, be processed properly, and then go into the bloodstream. What happens with what we call leaky gut or a permeable gut, we get little holes. And through those holes, different things can pass into our bloodstream. So undigested food particles, microbes, or other toxins. And that creates inflammation where? In the bloodstream. Your immune system says, I don't know that unprocessed food particle, I don't know that microbe, and I don't recognize that toxin. I'm going to attack it. It is foreign. So you get that immune reaction occurring in your bloodstream. That ultimately causes inflammation, which now once it's in your blood, it can go anywhere, including into the brain because it can cross the blood-brain barrier. So that's where we see something called neuroinflammation, a bit of a hot topic as well, because neuroinflammation has been linked to all sorts of different conditions, not just in children, but also in aging adults. CRP, which is a marker for inflammation in the blood. If you've ever had your blood work done, perhaps this was done just as a general assessment. But CRP levels were found to be 46% higher in people with depression. So again, we see an interesting connection between depression and inflammation in the bloodstream. If you're not sure if your child has leaky gut, some of the gut-related symptoms include bloating or gas, constipation, diarrhea, abdominal discomfort, and then we can see more systemic effects like eczema or skin conditions, allergies, mood changes, problems with concentration, learning, asthma, and then frequent colds and flus. All right, so how to target this? I'm going to dive into this a little bit more specifically when we get into the tactics, but just to introduce you to the gut microbiome, I'm sure you've all heard of our microbiome. What it consists of are living, healthy, and functionally beneficial microorganisms that also act as a protective barrier to help prevent that permeability. So on top of healing our GI tract, if we have this issue, we also want to look at supporting our microbiome. We also know when it comes to the gut-brain axis, neurotransmitters are produced in the gut. 90 to 95% of our serotonin is made in our GI tract. Serotonin is our happy neurotransmitter. That's what an SSRI and antidepressant will target, right? An SSRI increases serotonin. Well, so does the gut if we have a healthy one. Dopamine, the gut microbiome produces roughly 50% of your dopamine. This is another neurotransmitter involved in mood, but also in things like motivation, sleep, energy overall, and learning. So again, this will be an area to target when it comes to supporting mental health. I just wanted to mention something called short-chain fatty acids. I know this probably is maybe a little difficult to read, but I just pulled this afternoon some of the more recent research on short-chain fatty acids. Has anyone heard of short-chain fatty acids? Okay, 1 in 5, so good, not bad. Short-chain fatty acids are what your bacteria in your microbiome make. This is their byproduct. So it's now thought, things are shifting the more we learn. Is it the bacteria that are helping us, or is it their byproducts? Is it what they are creating and making in our body? It is thought that these short-chain fatty acids do actually play a massive role in everything in our body, from the gut-brain axis to the gut-skin axis to the gut-lung axis, the gut hormone axis, the gut-bone axis. There are all of these different axes that we are now discovering. And again, these are some of the recent research papers looking at short-chain fatty acids, specifically one called butyrate or butyric acid. And I tried to pull the ones that were relevant to brain health, especially in kids. So this is another one that I'll mention in the next couple slides when it comes to targeting. And then finally, that connection with ADHD specifically. ADHD is the most common neurodevelopmental disorder in kids and does persist into adulthood. And as we get older, this can impact our educational achievements, employment, and also increase our risk of other mental health disorders. So early diagnosis and treatment can provide long-term outcomes, which is, I think, why we're seeing more diagnoses occurring, right? I mean, we have to compare that to, or control it to variables and things like that, but I think we are trying to be mindful of that preventative nature. We know that there are positive correlations between ADHD and food reactions, toxins, nutrient deficiencies, and an overall unhealthy microbiome. And finally, when it comes to short-chain fatty acids, in 2024, it was found that kids with ADHD often exhibit lower microbiota diversity. So the average person has about 1,000 different strains and 100 trillion different bacteria, but 1,000 different strains. So lower gut microbiota diversity, maybe 500 or something like that. but also lower levels of those key short chain fatty acids, including butyric acid, compared to healthy children. And now that you can actually get butyric acid in a supplement, it's kind of great to see that possibility for treatment. Okay, segueing to brain builders, what we can do. Starting with diet. Diet is, there are so many different diets out there. There's a lot of research on a lot of different things, but over and over and over and over and over and over, the Mediterranean diet comes back as being classically the healthiest diet for multiple reasons. And of course, there are different iterations depending on what you can consume from a physiological standpoint or for different beliefs. However, this is sort of the breakdown. So proteins coming from cold water fish, free-range organic eggs, and poultry, but keeping your dairy and organic meat to moderation. Focusing on other things for protein include legumes and other vegetables and whole grains. When it comes to green vegetables and fruits, we look at leafy greens and cruciferous vegetables. The rainbow of vegetables, really, ultimately, the more colors, the better, because you're going to get more of those phytonutrients and antioxidants. So things like bell peppers and eggplant and okra and every color you can imagine. Fruits, we look at berries, of course, avocados, which also will provide healthy oils along with olive oil, nuts, and seeds. And then different spices to obviously make it taste better, but also to provide antioxidants and phytonutrients. And then finishing it off with dark chocolate that everyone wants to hear. So that's a basic goal. And you can find, if you search Mediterranean diet for children, so many different iterations. Yes, you can go and see a dietitian or a holistic nutritionist to help provide you meal planning and that sort of thing, but that's a great guideline and great place to start. When it comes to lifestyle measures, different ways sort of help balance the yin and the yang with children in their lives and their school and everything else. You can implement things like mindfulness or meditation. There's other ways, of course, to do that. Counseling and cognitive behavioral therapy. I find this because I work with a counselor at my clinic in Royal Oak, and she does see children, and she does a lot of CBT, especially to help with that negative narrative, right, that can go on in kids' minds, and just allowing them to be understanding and to see that and compassionate with themselves about that negative thinking so that they can respond or change that mind frame and also respond to challenging and stressful situations in a different way and more effective way. So I find that can be very helpful. Physical exercise, we know that physical exercise and being out in nature overall is extremely beneficial for everyone, all ages, but it's something that really should be implemented about 1 hour a day. We've got another slide on that coming up. Hydration, 75% of the brain is water, so why not? We want to feed that brain. If your child ever says that they're thirsty, what does that mean? Really, they've been dehydrated for a little bit of time. The thirst signal in our brain doesn't come on until that dehydration has actually set in. So, watching for those cues, but also you can check skin trigger, which is you pinch your skin and you just see how quickly it bounces back. You do that with your kids. That's just sort of a way to assess hydration status. 1.5 to 2 liters is what we say for adults. So it depends on your child and how big they are. If they are drinking a lot of water and they are quite active, then I will consider electrolytes for kids. But I'll usually just do a pinch of Himalayan salt, just to be simple, something they're not even going to necessarily taste, but it does provide some of those essential minerals so that their osmotic regulation doesn't get shifted by drinking too much water, right? Because that can just cause water retention or a lot of peeing, and then you won't retain that water in your cells and in your brain. So you need that electrolyte to kind of balance that out. Okay. So I did mention exercise. It's recommended for kids age 5 to 18 to get an hour of daily physical exercise for a lot of different reasons. Obviously, confidence and social skills, coordination, concentration, learning. It strengthens muscles and bones, improves health and fitness. It helps to maintain healthy weight. It does improve sleep, and it improves our mental well-being. So any amount is good. Even 2 hours a week of moderate exercise or an hour of vigorous exercise was shown to provide anti-stress benefits, but really aiming for that 1 hour. I think Again, my daughter's not in the school system yet. I think they get an hour every day. I don't know, is that not what they get? They definitely don't? Okay. So we'll be running to school. Yeah, that's so extracurricular activities and things that falls on you, especially after school and on the weekends. Okay, and then as parents and caregivers, you have that power, you have that opportunity to, play a role and be a role model for your children. I know life gets busy and things get in the way, but being in a lot of ways, the 80-20 rule is what I tell my patients, because we can't all be perfect, and I don't ever expect perfection. There is no such thing anyway as perfection. But 80% of the time, know that you're following these guidelines, you're providing that routine, you are putting good food into your body. And 20% of the time, if you aren't able to, not to be hard on yourself or your children, because moderation is really important, especially everything in moderation and taking that in moderation, et cetera, et cetera. So some of the things you can do is help to provide those examples of healthy foods to your children, get involved in the cooking process or the prep process so that they understand, like baby carrots are not baby carrots. Understanding that things come from different places, visiting a farm, going to local farm stands to understand where food comes from. Breakfast is always very important, especially because it ensures and provides that routine for children and gives them that energy to start their day. And then on the opposite side of things is having that quiet time and relaxation and time without their devices. It is recommended to, if you can, 2 hours before bedtime, things are shut off. 1 hour minimum. And for you as well, adults, it's really important to help with circadian rhythm and just grounding yourself and sort of getting back in touch with, your day and your mental health. Okay, so finally on to those specific nutrients. Maybe this is what you came for specifically today, just to understand how you can help your kids from a perspective of protein levels, microbiome support, so probiotics, prebiotics, postbiotics, and then some nutrients including vitamin D, magnesium, and omega-3 fatty acids. And then I'll finish with 2 phytonutrients that you can find, L-theanine and saffron, that will be supportive for kids and their mental health. Okay, protein. Protein's getting a lot of attention right now. A lot of people are on the high protein kick, which is, protein is really important. Adding in more protein can also replace some of those processed foods, hopefully, and some of those refined carbs. So that's another reason why it's helpful. From a numbers perspective, target protein, depending on the size of the child, is around 0.5 to 1 gram per pound of their body weight per day. And that's divided between, different meals, not all in one go. Little kids up to around the age of 5 or 6 actually, though, have it's interesting, they assimilate their protein and their nutrients a lot better than adults do. The adult body just, might absorb 5 to, I think it's 7 to 12% of nutrients. We don't absorb that much out of our food or out of our supplements, and that's why, we do supplement. But children have a better way of doing that, just the way that their bodies are. So it does slow down as they, get into their sort of school-aged years. So that targeted protein is more once they are over the age of 6 or 7. So protein is important for ensuring growth of muscles, bones, hormones, hair, skin, immune system. It's a fuel source for cells and tissues. It supports our brain. And we know that low protein diets have been shown to cause behavioral abnormalities, including hyperactivity and learning problems. Okay, moving to gut support. So I've already mentioned postbiotics, went on a little bit of a tangent there about butyric acid. But probiotics. So probiotics are essentially those living beneficial bacteria that we can take in the form of food or supplements. So foods include yogurt, kefir, sauerkraut, kimchi, kombucha. Maybe they're going to likely just go down the yogurt aisle there. But if that's difficult for them to consume, then you can look at probiotic supplements. I'll mention one in the next slide. Ones that have strains that are specific to children's guts, what you want to look for. And of course, something that your child will like and actually stay compliant with taking. Prebiotics, these are the things that feed our good bacteria. So that's going to be different types of fiber. You're going to find those in different plant-based foods. There's soluble fiber, there's insoluble fiber. So getting a mix of fruits and vegetables, whole grains, legumes is going to help you with that. Again, you can also supplement. Some people and some children have issues with digesting or with tolerating fiber, some certain types of fibers in foods. Or if, say, some child has sensitivities to certain grains and you're limiting that and they might not be getting enough fiber, then you can look again at supplementing. That really will help with your gut integrity. And then postbiotics, again, what we've already talked about, but those beneficial compounds made by our microbiome, like those short-chain fatty acids. So that really is, you can't get that in food per se, not very much at least, but you can supplement with those sorts of things. But just by supporting the good bacteria and providing that fuel source, you will help support those short-chain fatty acids. So one supplement that we'll talk about tonight, and again, there's probably multiple on the shelves, and I'm happy to stay after if there are any specific questions. This is just what I chose for tonight. This is a gummy version, again, quite popular with younger children because it tastes good. It doesn't have to be refrigerated. It's not hard to remember to take it because you can leave it out. And it does have the specific strain of Bacillus coagulans. So this is one type of bacterial strain that is beneficial in children's guts. It contains 1 billion active cells. So it is suitable for kids over the age of 3. Really, that's all about choking hazard. So younger kids could potentially benefit from that, but just you have to watch with the chewing. So it's going to provide those sorts of probiotics to help with the intestinal health and create a nice favorable gut flora. It will help with things like diarrhea and constipation, helps to normalize that. Again, if that's not the only thing that's working, then you can add in things like fibers or prebiotic fibers. Like any probiotic, it's also important to take this away from an antibiotic. So if they happen to be on a medication for something, infection, I do highly recommend taking it on the same day. Don't wait your 7 days for that antibiotic to be done. Please take it the same day. Just take it a couple hours away from that antibiotic so you don't kill the bacteria in this product and waste it. It will not interact with antibiotics though. All right, omega-3 fatty acids. If your child is not eating, lots of fish or lots of nuts and seeds or avocados and different things like that, you might look at supplementing with omega-3s as well. There's other reasons why, eating a lot of, even if it's cold water fish, might not be a great idea because of the heavy metal burden. So that's another thing we have to manage and think of, the pros and cons. So omega-3 fatty acids in supplement form could be the answer. They're very effective in moderating inflammation. They're involved in brain function. In fact, one of them, DHA, makes up 40% of the brain's fat. In total, our brain is about 60% fat of the solid mass part. So it is clear that these omegas are specific to helping with brain function. The reason why omega-3s tend to be more of an issue, especially in North America, is because of our ultra-processed food intake. So not only are we not eating enough omega-3s, but we're eating too many of the omega-6s, which contribute to inflammation. And those two need to be in a very sort of strict ratio of roughly 1 to 4. So you should be consuming 1 omega-3 to every 4 omega-6 when it comes to food. The average ratio in North America is 1 to 20. So we're consuming 5 times more of the omega-6 than we should be to balance out health. And so to support that, yes, we bring down those ultra-processed foods and those rancid seed oils that we may be consuming and increase the amount in terms of the omega-3. Corn oil, sunflower oil, safflower oil, canola oil, those sorts of things contribute to the omega-6 excess. When it comes to supplements, this can be tricky because they don't always want to be tasting fish oil, right? I don't know if you grew up on having cod liver oil as a child, but I remember having that. Not a fun, enjoyable experience. Things have come a long way. Omega-3 is coming from the small fish, sardine, mackerel, anchovy. These are small fish. They do not have a heavy metal burden like we might see in something like tuna. because those are much larger and longer living fish. These products anyway are all tested for contaminants and processed in a way to remove any kind of heavy metal burden. Regardless, the liquids have come a long way in terms of flavor. This is one example. It's specific to children, cotton candy flavor. So, most children would enjoy that. It is all natural flavored as well. Or if they can swallow pills, they're a little bit bigger, you can also opt for some small versions. These are called mini gels, so they're omega-3s, and you just swallow them. They're about this, maybe about half the size of that typical fish oil that you might see. So for the older kids, they could take that. I wouldn't want to necessarily chew it. They're going to get straight fish oil, and they might be scarred. But two options. These are also great because they have been tested for contaminants. They are non-GMO. And they are going to provide both the DHA and the EPA that are the specific omega-3s that are required for brain function, for nerve function, and inflammation. The other benefit, this one here, the liquid, is from the brand Sealicious. It also has a little bit of vitamin D in there as well. So if you're looking at vitamin D, which I'll mention in my next slide, that's a great way to get everything in one. And there's no fishy aftertaste, which is another bonus when it comes to fish oil. Okay, vitamin D. Vitamin D levels, a bit of an issue here, especially in this part of the world, children and adults. You may have heard that, I don't know if it's Health Canada or the government of Canada has made it mandate that all the dairy companies double the amount of vitamin D that they're fortifying, that they're adding to their milk products. So Canadian dairy products add vitamin D. And I think it was just last month that they've raised that requirement to be double, because they realize even after the last, 20 years of fortifying, it's not doing much benefit for us, right? It's not keeping our levels to where we need them. We're going outside in the summer, we're getting that ultraviolet exposure. It is ultraviolet that actually activates our vitamin D in our body, but a lot of us are wearing sunscreen, or we're not going out. Sometimes it's too hot, we're getting the heat domes, all of this sort of thing. We're definitely doing that with our children. Right? I mean, every child is pretty much slathered in sunscreen. So their vitamin D is not, they're not making the same amount of vitamin D that they would normally.